Good morning. Welcome to the Playful Life podcast. I am your host, Krystal, the Playful Trainer, and I have an awesome guest today. I'm so excited that he's joining me from his brand new direct primary care practice, and so cool that he's actually in his office doing this podcast with me. And his name is Dr. Patrick Hobbins, and he has his doctorate in osteopathic medicine from Des Moines University in Iowa. And we're going to get into a little bit of, what's the difference between that and the MD or, something that you may be familiar with most doctors. So I'm really excited to talk to him. He has a brand new practice, like I mentioned, and just a different approach to medicine in general and how he views the patient experience. And I think we're going to have an awesome conversation. So I will introduce him here. Gotta get him ready. Here you go. Hello. Good morning.
Good morning, Krystal. How are you?
I'm doing excellent. How are you?
Good, thank you.
Wonderful. And I just want to, before we even start, comment on that beautiful tree behind you.
Yes. Yeah. So the logo for my practice is a tree, and actually the kind of trunk turns into branches that look like people who are, kind of healthy and joyous. And so I love kind of the metaphor of a tree in medicine. Trees just are kind of a majestic, living thing, that the way that they kind of, withstand all the different stresses that they're exposed to is really incredible. So leaves that capture sunlight for healthy energy for them, roots that pull in water and nutrients. And so you can kind of learn a lot about human health by knowing about the health, how a tree works. And so that's kind of a theme throughout our practice. It's on our logo. It's on my webpage. The picture behind me, like a lot of the items that decorate my office, my wife had a big hand in that. And on this particular trip, we were looking at different artwork, and this photo just really jumped out at us with the sun rising kind of in between the limbs of the tree. So we're definitely kind of trying to go for like a natural approach to health here as much as we can. And the tree definitely just kind of embodies that. Plus, they're just really pretty to look at. And So you'll find a lot of plants throughout the office, lots of pictures of trees. In fact, we don't really have room numbers. We kind of go by season, and then there's a photo of a tree in each room. So we have like our fall room, our spring/summer room, and our winter room, and they all feature different kind of trees. So that was kind of part of the inspiration of what we're trying to do here, just a natural approach to health.
That is awesome. And how cool. I don't even know if I noticed that when I was in your practice the other day, but that's really cool. And I think that it really adds to the patient experience. And that sounds like something that, you're really tapped into with your kind of different approach, like you were saying, more of a natural approach and a really caring approach with your patients. So how cool that, they can, even from the little details like that, just really know how much you care for each patient individually. And, speaking of different, we were kind of talking a little bit before this, but I mentioned that you have a DO after your name, Doctor of Osteopathic Medicine, instead of an MD after your name. And you said, well, there's a difference, right? So maybe tell people a little bit about that.
Sure. So a lot of people don't know that there are two types of physicians that are fully licensed to practice medicine, and those would be MDs and DOs. So, there's probably many more MDs throughout the country, but people getting their doctorate of osteopathic medicine, it's definitely growing. There's new schools kind of popping up all over the country with that. So both are fully licensed to practice the full scope of medicine. So I have DO colleagues that are neurosurgeons and cancer doctors and pediatricians. And so we're in all different arms of medicine. But the main difference in our training, I would really say the academic work is generally the same. Your pharmacology, anatomy, physiology, all those things are pretty much the same. But DOs also get hands-on training in what is called osteopathic manipulative therapy. And so you can kind of think, we call it OMT, and you can kind of think of that as a hybrid of massage meets stretching meets chiropractic. There's lots of different techniques that we can use, and they are aimed to kind of increase range of motion of the joints, increase alignment and mobility of the spine. There are cranial techniques that are used to work on the head and can even influence kind of the shape and development of the head and address really issues all throughout the body. So it is something that all DOs get a training in. A lot of there are DOs who make that the entire focus of their practice, knowing that some of those principles can affect your general health in a big way. And then there are others who kind of get into specialized training, and honestly, some of it kind of goes by the wayside. In a lot of ways, it did for me as I kind of trained in a traditional family medicine. In fact, the residency program I went to was more of an MD type program, and so there's overlap in the training, but it always, I think, influences the approach that as a DO, as a physician, we take to our patients. It took some getting used to. I mean, we were all stressed out medical students, learning all the heavy hitting academic stuff, and then, oh, by the way, for an hour and a half every week, we have to go and basically put our hands on one another. And it was something that you had to learn. Now I realize, like, even in the times of COVID and with being careful, I will physically touch every single patient I see when they are here for a visit. And it's just something subtle, like a hand on the back when I'm listening to your heart or something like that. So you definitely you develop a comfort with really a hands-on technique. But what's really cool is the ability to actually use your hands very well in making a diagnosis. And there's certain things that you go off of feel, and so it definitely helps us to refine that skill. But when you kind of have that bit of a physical connection as well in a very healthy way, it always influences your approach. So when I interact with other DOs, it's almost like we have this kind of knowing that we each went through that. And a lot of my DO colleagues would say, like, hey, why don't you give me some OMT? And they're like, hey, I haven't done that in a long time. I don't think that's a good idea. Versus others who, if we know someone who's really good at it or skilled at it, it's like, hey, let me get on your table and see what you can do for me here. But so that's really the biggest difference. How each individual physician applies that, it varies very widely amongst osteopathic physicians, but it definitely kind of colors our experience as a physician, even if we don't use that particular skill all that much.
Oh, that's amazing. Yeah, what a cool explanation that you had of that too. And I've had different people on the podcast, massage therapists and people who do Reiki, and we always kind of come back to that conversation of the importance of human touch. And I think now, especially in the world of COVID, right, people aren't hugging or even just having that human connection at all, right, going out, and some people live alone. So how important it is to have human connection, and human touch can almost be healing in a way in itself. So that's really cool.
Yeah. So I definitely enjoyed it. I felt like at first, I still can think back and remember, like, our first lab was like, okay, put your hand on your partner's back. And I was like, no. And then after a while, it was like, we went into the lab and it was like, hey, hop on the table. I'm checking your hips. I'm checking your shoulders. I'm checking your back. I'm cracking this. I'm stretching that. And of course, lucky for me, like, I just love that stuff, being the recipient of hands-on, whether it's like massage or OMT or chiropractic. So that part was easy, but learning how to do that was definitely an added bonus. And my family would tell you, as I was learning, I had to practice a lot. So the table would come out, holidays, family gatherings, and a line would form, and everyone would kind of get their treatment. And once I knew enough to pass all my classes, I was like, hey, I'm just gonna enjoy this event and not really try to be working for everyone right now. But it is something I'm kind of trying to reintroduce into the practice here. And I'm certainly not like at the top of my skill set as I was right when I was finishing medical school. But it's kind of like riding a bike. A lot of it comes back to you. And so it's definitely something that we're offering here and looking to incorporate into the practice.
Awesome. So let's talk about that a little bit. So Hobbins Medical, and you're in St. John, Indiana. And so gosh, I'm sure there was a big process of, sort of the inception phase and thinking about it and then making it all come to life. But was this something that, when you were in medical school, you always thought you wanted to have your own practice? Or is this sort of an idea that, maybe God gave you halfway through, your first couple of years practicing medicine?
Yeah. So I did not really think that this was something that I would do when I was in medical school. My kind of mindset was like, I want to find a place to work that has like the best setup, like the best computers and exam rooms and malpractice insurance. And I really wanted all of the stuff outside of just patient care, like taken care of for me. And so that's what I did. And certainly in my training, that was a great thing. But then as I finished my training and kind of became an attending physician, developed my own patient practice, and that, I was working in a system that was very efficient at seeing patients. I didn't have to pay rent or pay my own malpractice or pick out artwork and furniture and that kind of thing. But really, the direct primary care model is something I probably first maybe heard about it 5 or some years ago. I had heard of kind of concierge medicine previously, and this is direct primary care is a little bit of a spin-off on that. And so what direct primary care kind of offered me was the ability to contract directly with my patients in an insurance-free model and offer them a lot more than I could in a traditional setting.
Am I there?
Yes, I'm still here.
Okay. I went away. My picture went away, but my voice is still here. So I don't know what's happening.
Okay.
Kids are probably starting their e-learning, but that's awesome. And I get that there's merit to both, right? Having the situation where you can, what I'm going to do right here. Here we go. There. Okay. You can see me now.
Yeah.
Okay. So, having the situation where you can. Oh boy. Okay. I'm there now. Okay. Sorry about that.
Okay.
With technology, there's always something. Where you didn't have to worry about those things, right? Where you were sort of working with other doctors and had the insurance paid for you. You didn't have to worry about maintenance on the building and all of that. But I think, some people have the entrepreneurial spirit, right? Where you say like, I really want control of this, or, I want it to be my own. And so that's awesome that you took the leap and even did that, because I think a lot of people get comfortable in that situation and go, oh, this is working fine.
Yeah.
But, I think that speaks very loudly of you to say that, you wanted more, right? You wanted to fulfill this dream for yourself. And so I'm really excited. I think people are going to love coming to see you at your practice. So as far as we were talking about, you said you wanted to do things a little bit differently and have your own place. And so what's the vision for that? As far as looking, a couple months ahead, a couple years ahead, where will your practice be and what will it look like for people?
Okay. Honestly, hopefully it will look a lot like it does right now, only just a little bit more full with patients. We opened just a few weeks ago, so we're definitely in a growth phase. And but what I guess probably to even take one more step back to explain a bit more about what direct primary care is and kind of how I came to that. So it really at its core, it's a different payment model. So in kind of a traditional setting, insurance companies pay for your primary care visits. And so that really flavors everything. From a patient's perspective, they have a deductible that has to be reckoned with. So they still pay for a lot of at least their initial services. And then there's the premiums that they pay with that. So from the patient's perspective, there's that to deal with. From the physician's perspective, what is happening with insurance reimbursements is they're going down. It's not really a secret. They're going way down. And so the kind of tool to compensate for that is to see more patients, see them faster, and to really build a large practice that can sustain you with frequent visits. And as a primary care doctor, you really get paid for one thing. You get paid by an insurance company for doing a visit. As a direct primary care doctor, the payment being that it's a monthly membership paid directly by the member. Number one, we don't really have to play within the restrictions of the insurance company. And number two, we just don't have to rush through the visits and have so many visits to make ends meet. So it really aligns the incentives. The incentive for the patient is to say, okay, I'm paying for this membership because I believe in this, and so I'm going to use it. And so I'm going to use it to see Dr. Hobbins. I am going to use it to email him. I am going to use it to text him. We're going to do a telemedicine visit when I'm on the road or busy with work. And so you can kind of take advantage of those things. What's great for me is the incentive is now no longer, let me see how many visits I can do in this day and try to do more the next day. Now the incentive is just do a great job. Be available, answer questions, be thorough, don't rush through the visits. And so the patients get really a lot more when you're caring for them that way. And my incentive is to do a good job. Your incentive is to get the care you need. In the traditional model, the doctor's incentive is to work fast, and the patient's incentive is to maybe not have to dip into that deductible and start paying that first bit out of their pocket. And so that leads to the big issue of people maybe ignoring things or avoiding preventive care. So really at the core of direct primary care is the belief that health insurance does not belong in primary care. And I use the analogy of auto insurance. So with auto insurance, you don't use your auto insurance when you get a new tank of gas or an oil change. You use it when you crash into a wall or when you're in an accident. With health insurance, my kind of thought is, hey, you should use that if you become hospitalized or have a catastrophic injury or illness or need a procedure done. But probably cash payment is the best way to go for primary care needs. So that's kind of really the spirit of how the model works.
Oh, that's a great analogy. So perfect and so true. And I remember being in that situation. Well, I still pretty much am, where I was working a full-time job and still did not have any medical benefits, no insurance. And so, I had to kind of look at the marketplace and get that insurance. And that was a whole headache in itself. And I feel like the insurance that I did have didn't really pay for anything because I had such a high deductible that when I chose to go to the doctor, I still had to pay out of pocket. So, and even then, oftentimes felt like I was shuffled in and shuffled out. And so just brilliant model. I think people will be really receptive to it. And I love how you explained that analogy. And I think that's a great message going forward to sort of like just really educate people on that, because I remember working in the dental practice, even people just assumed that their insurance paid for everything. And it's really not like that. It's a benefit and, something that just sort of helps you in that situation. But very true, right? When you run into an issue, that's when you need your insurance. But the goal should be to avoid those issues as much as possible, which is so important.
Well, you actually bring up another good point. And one of the kind of like principles of our model is price transparency. So with you working in a dental office, you probably have had the experience of a patient calling and saying, oh my goodness, I got this huge bill. What is this all about? And, what happens is, certain services are expensive and they get submitted to the insurance. They kind of manipulate them and say, well, we're not paying this part, or they owe a deductible, or we're only paying this much, or they were out of network. And so they kind of come up with all these excuses to either whittle the reimbursement down or to transfer it back to the patient. And so they are, yes, you're exactly right. People in our model, we kind of call it insurance addiction. People just have this thought and belief, like, I've got insurance, I'm good to go here. And what honestly happens is you pay twice. You pay those expensive premiums, and then you pay that deductible. So price transparency is huge for us. Number one, there's nothing to be ashamed of with our pricing. It's very affordable, within reach for most individuals. But the other thing that we can do is some of the areas we save our patients money is with their medication costs and their lab costs. And they know exactly what they will be paying for a medicine I prescribe or for a lab test I order before they do it. So there's no, getting your service, crossing your fingers that the bill's not that bad when it comes, and you kind of sort of forget about it. Then the bill shows up and you're like, oh my gosh, I have to call the provider. I have to call the insurance. I have to, resolve this somehow. With direct primary care, it's like, my membership costs this much, my medicine costs this much, and the lab work is that much. I know what it is. I can choose to get it or not. And it's very transparent, but also most people are pleasantly surprised to find out how affordable the common things they need are when we arrange that for them.
Oh, excellent. Yes, that's very true. People are oftentimes very blindsided by those things. So I think that's huge to be able to say, this is what it is, this is what you're paying, and people will certainly appreciate that.
Right.
And kind of along those lines, right, sort of avoiding the things where you would need to use insurance and, having regular visits with you and things like that. Like, as far as preventive, measures and medicine, what are your views on that? I mean, this podcast is all about, helping people live their best lives and be healthy from the inside out, and, mental, physical, all that wellness. So, what are some of your strategies or some of your approaches to preventive medicine with your patients?
Yeah, good question. So, a huge part of all primary care is preventive medicine, or should be. And so as a family doctor, we always recommend everyone get a yearly checkup, really all ages, and, more frequent than that for infants and young children, but most adults anyway should be getting a yearly physical. So at those, we follow preventive service guidelines, which are well published. So blood pressure screening for diabetes, for high cholesterol, for obesity, age and gender appropriate cancer screening for depression. We kind of have like a whole checklist of items. And then, of course, having a good physical exam. A lot of times during the exam, I'll notice something along the lines of a problem on your skin, or a heart murmur that wasn't known before, or some, abnormal breath sounds in the lungs that can point towards asthma or something like that. So, that's hugely important. And honestly, I've learned over time that, any doctor can do that. They really can. But how do you respond to the abnormal findings that come up? That is crucial. Okay. Because we will find borderline cholesterol, high cholesterol, borderline diabetes, full-blown diabetes. And so that is where the paths really diverge. If you get a quick phone call from a nurse like, hey, your blood sugar is very close to the diabetic range, so the doctor says you should eat better and come back next year. That's a big difference for, hey, you better come back in here. I want to know everything you're eating. I want to know about your movement and exercise. I want to know about your stress, your sleep. I'm going to recommend these foods. I'm going to recommend you cut this out. I'm going to recommend you include more of this. I want you to weigh yourself. I want you to check your blood sugar. I want you to report back to me. So that's like jumping in with both feet and making a difference, actually, versus a checkup that's kind of an afterthought. And I think, probably people listening might have had that experience of like, yeah, I went in, they went through the motions, but I didn't get much out of it. And so being really tuned in to those things is what makes all the difference, and truthfully makes you much healthier, which makes you feel better and saves you and our healthcare system a lot of money, especially, as with your work with insulin resistance and both the obesity and diabetes like epidemic that we have going on, boy,
Right.
it's so expensive. And so if we can take one person and kind of pull them out of the borderline range or even out of the diabetic range into a normal blood sugar, the amount of money saved in medication, in testing, and additional screening, in illness that comes along with it, it's literally astronomical. You probably can't even measure what you're doing, but also what you do for someone's life. Better weight, not having to check their blood sugars all the time, just feeling better, more productive at work, all those things. So that is really, it took me a while to learn and understand what are all the boxes I need to check at this preventive visit. But what's been really fun is by paying attention and utilizing other resources that are out there and partnering, is using it as an opportunity to actually make a difference. So for us, it always starts with like that yearly checkup. But it's pretty rare that I just say, okay, you checked all the boxes and off you go. Like there's always something people can work on with their health. And some people have a huge list, some people have a small list. But that's definitely something I'm passionate about and believe in because of the difference in outcomes when you have a thorough physical that leads to maybe some lifestyle change that makes you healthier and spend less money on healthcare versus, hey, I checked all the boxes. You need to eat better and see you next year. Well, next year you might weigh 10 more pounds, have higher blood sugar, and now you're on medicine and you're seeing a specialist and you need to get a dilated eye exam and you need to, just all this stuff happens. And so I feel like it's my responsibility to stand in the way of that for sure.
Yes. Oh, that's beautiful. And again, right, you wouldn't drive your car without gas. You wouldn't, go without an oil change for a couple of years and, all these little things. And, you wouldn't drive along the road and notice a noise in your car. And then they go, well, I don't know, that noise is probably fine. Just come back in a year, right? You probably would not be driving that car for very much longer. And, people, again, like people will drop all kinds of money on their cars, on their phones, on their electronics, right? I mean, I'm guilty of that too, even, right? That, oh, well, I need to pay this money to get this fixed. But then when it comes to our health, we oftentimes, really neglect those things, the warning signs and things like that. So, having
Yeah, I mean, unfortunately, you're right. A lot of people treat their vehicle and their pets better than they treat themselves. And good health is something that most people is just never appreciated until you lose it in some way. And you usually don't just wake up and your health is gone. Like it's a process of getting there. And there's multiple opportunities that were there to intervene and reverse something that was happening. So that is your job and mine to like, how do we wake people up to this? And because I also understand that no one, especially, studies would support just men are not into preventive care. It's not on their radar as far as something to do. So I definitely have kind of learned to make a plea to, women. They seem to make many of the healthcare decisions within the household. So hey, if you can get the guys on board with their checkup and everything, of course they need to get their checkup too. And it's not their job to take care of everyone else first and then themselves. But I have noticed a pattern that like, unless men get kind of nudged off the edge of going to the doctor, it just doesn't happen. And then I see them, it's like, oh, nice to meet you in the middle of this terrible health crisis. Where were you last year or a couple of years ago when we could have handled it easily?
Right. Yes. Yes. Speaking of health crises, I feel it would be remiss if we didn't, just touch on what's going on right now in the world, obviously with COVID and all of that. So, of course, underlying health risks of diabetes, obesity, these things, tend to make people more susceptible to not only catching a virus, but having complications with it. So, as a primary care physician, what's been your experience with it? What are some of your maybe suggestions for people as we go into the winter months and, in dealing with this?
Yeah, good question. My experience with the virus has been pretty interesting. The pandemic was just kind of coming into full swing as I was leaving my previous place of employment and kind of setting everything up here. And I would even, say that it probably in some ways delayed the opening of my practice. And because of that, I kind of had the misfortune. I know many people's, their employment has been impacted by it. And I had a master plan. So man plans, God laughs. My plan was to kind of finish that job, have this office ready to go, transition right into it. And then the pandemic hit and it really slowed things down. So my pivot for that was to kind of roll up my sleeves and begin some work at an urgent care center that had really made what I think was a very noble kind of effort to test for and treat COVID-19 on an outpatient basis. So a lot of these institutions and facilities they all started scrambling. They didn't have enough supplies. They had to divert resources to other places. So I was able to work at a local urgent care that was doing full-scale testing and treatment on an outpatient basis. So, in a normal shift, we would test a lot of people. And I was fortunate that they had good protective equipment, pretty efficient systems it's hard to treat patients in a parking lot, but that's what we were doing. And so I saw a lot of people that we checked that were positive for the virus. A lot of them that thought maybe they had it were negative, exposed, maybe they had it, maybe they didn't. Sick patients that had COVID-19, not sick patients that had COVID-19. And what still probably stands out to me was people sick with other stuff that came there with concerns of COVID-19. I remember sending a patient straight from our parking lot to the emergency department. I said, I'm still going to test you for COVID-19, but I can tell from the side of your car that you are in full-blown congestive heart failure and you need to go to the hospital. So that it has been, such a confusing, challenging thing. Access to care has been totally impacted. It's just been wild. And it's hard, like many things, it's hard to know where to get the best information from. So a couple of thoughts I have in terms of prevention and treatment. And really, this is just speaking from the outpatient side. So I don't really have hands-on or firsthand experience caring for like patients critically ill with COVID-19. But on the outpatient basis, it seemed very easy and reasonable, safe to recommend vitamin C and zinc to all patients who either had or were presumed to have COVID-19. Both are kind of known for their immune boosting properties. So that was just kind of a safe, easy recommendation. And very interestingly, I think was effective in many ways. We had the fortune of we would test the patients and then we would follow up on video, much like we're doing now. And you could tell very quickly, like if we're following up with the patient and you could see that they're moving about the home or maybe they were outside or whatever, versus sometimes we click on the screen and I could see they're kind of holding up the phone and they're laying in bed and they're still struggling. So vitamin C and zinc is safe, seems to be effective. Both have kind of a long-standing history of boosting the immune system, so that can be quite good. We played around with antibiotics a little bit. It's hard to answer. The question is Zithromax safe and effective for COVID-19? Without having great, thorough data on it, if someone's coughing up phlegm and sick and feverish, it's probably not wrong for them to take an antibiotic that might be helpful in COVID-19, and if given to the right patients, is not really a harmful thing. Hydroxychloroquine. So I also actually did some COVID treatment through telemedicine and through kind of more of a nationwide, I guess, chain of telemedicine providers. And it was interesting that we actually would have patients demanding hydroxychloroquine for their COVID-19, and it was a little bit regional. Certainly patients in New York City seem to need and have this want for hydroxychloroquine. And so it's hard for me to really comment on whether I saw that as a helpful tool or not. But My own thought is that I have seen it used and used it for the conditions it's commonly used for, different autoimmune conditions. And again, if you're a careful clinician, you know which patients it's generally going to be safe for. And then people who have cardiac or cardiac conduction problems, you'd obviously be running the risk of affecting their heart with that medicine. So, but like most things, both prevention and treatment, just having a foundation of good general health is probably the most important. So if you're interested in preventing colds, flus, COVID-19, you want your immune system up and running and ready. And so sleep is probably a huge and understated factor in that. I think most people, when they're sleep deprived, you know that feeling of when you were just drained and you don't have your energy and your body's going to ration things, and immunity is one of the first things to go. It's like, hey, I got to keep the heart pumping, the lungs breathing, the body moving. So resources devoted to immunity can go down a little bit. Your diet is hugely important. Our immune system needs a lot of nutrients and vitamins to be healthy. So if you're eating a lot of fast food or just missing your vegetables, fruits, your phytonutrients, your vitamins, your minerals, you're going to suffer and you're going to be more susceptible to those infections. So sleep, diet, exercise is just a great way to literally move your body, move your immune system, the lymphatics, and increase blood flow to let it get to areas of the body where defense is needed. So that's important. I would also say that exercise is quite important to have the right balance. So if you're into like extreme workouts and that kind of thing, just know that again, your body has to repair a lot after that, and so you would want to either step up other parts of your lifestyle to boost immunity, or just take it into consideration, like, hey, maybe 3 miles was good enough for my run today, and I don't need to do 10 today in the cold or wet or something like that. And then stress. Stress is a huge player in the immune system, and most people are familiar with that. I certainly know when I was in medical school, we had, unfortunately, it was kind of like cyclic stress, and I could see and feel changes in my body every time a big important exam would come around. And I could see it in my classmates. It was actually, at the time we just felt like we were going through it, but you could see people's skin didn't look good. They had bags under their eyes, sniffling, coughing. So my best recommendations is have a good foundation of general health. Get most of the nutrients that you need through a healthy diet. Vitamin C and zinc are safe and healthy when taken within, daily allowances for most people, if you're looking for a little extra boost. And then, like everything else, don't delay. If something is feeling wrong, thankfully we've mobilized to where you can be tested for flu, you can be tested for COVID. And so find out what's going on, do your part to help contain the spread. Don't try to ignore it like a rattling muffler on your car. Like, get it checked out. So number one, you can get better faster. And number two, you can play your part in kind of containing the spread of the virus.
Awesome. Thank you. And I didn't know that. That's very interesting that you were in sort of that urgent care environment. And then, like you said, helping physicians nationwide to sort of be on the front lines of this. And I think people get really frustrated or impatient, and they're like, oh, they tell us one thing, they tell us another thing, and it's one of those things we don't really know a lot about yet. So from your perspective as a physician, I'm sure you're just treating it the best way you can, and people just need to be very patient with the process, and like you said, just kind of take responsibility for their own well-being in the meantime.
Right.
And you mentioned, stress and all of that. And I certainly encourage people to reduce their amount of stress. I mean, that's obviously a big part of who I am and what I do. But what do you do, Dr. Hobbins, after, maybe you saw a lot of patients at the urgent care clinic or something like that? How do you unwind? What's your playfulness like in your everyday life?
Oh my gosh, we'll have to do a consultation offline after this to get me on track with that. Um, I will fully admit that I am terrible at following my own advice with that. I will say that for me, probably my exercise regimen is something that has really kind of helped keep me grounded. So kind of for me, it actually kills two birds with one stone. It's stress relief, but it's also kind of the movement and health that I need. So I am an early morning exerciser, which I love doing that because I feel like it doesn't really take away from family time. I'm always trying to balance things. So I actually like getting my movement in while my family is still sleeping. And I'm just kind of an early riser. So I would really encourage anyone who's thinking about starting an exercise program to think about doing it first thing in the morning because it's out of the way, it's done. And it doesn't take away from some of your other responsibilities you may have as a parent or a worker or a caregiver or whatever it is that you have going on. And for me, it's evolved in many ways. There's certain things I can't do with my body anymore that I used to be able to do. So some days it's walking, some days it's yoga, some days it's like weight training with much lighter weights than I probably used to use in the past. Some days I feel good. I'm like, all right, I'm gonna get out there and run a little bit, and so forth. So that's been a really good thing for me. Reading is another good one. My problem is I tend to always read more medical stuff. I probably should give my mind a break from those things a little bit, but that's something I recommend to my patients a lot. So I would say those are kind of the things for me. And then when I'm kind of in dad mode, interacting with my kids. Now we're back to like doing homework. Which I actually enjoy doing that with my kids. I think for me, it's just a good distraction and it's a chance to really focus on their growth and development. So just family time. Just family time is always good for you, I think.
Yeah, well, that's wonderful, and your family is just so adorable. I've known your wife a long time. We knew each other as kids, and that was kind of crazy how it's such a small world it is. But so your kids, what's the situation for them? Are they back in school? Are they e-learning? Are they half and half?
Yeah, so they actually just went back to in-person learning just this week. So we've been really, I think my experience talking with teachers and other parents is that they've been pleasantly surprised at how well they've adapted to staying apart from the other students, wearing their mask, cleaning their hands. So they seem to be doing great. And what's really wonderful is seeing them like crawling into bed at night and just like falling asleep quickly. And they don't have as much energy to just like goof around maybe as we did when they didn't have the structure of school. So it was, like a lot of people, we got pretty unstructured with the pandemic, and so that led to some interesting things going on around the house, like sleeping in, staying up later, just spending too much time goofing off, and maybe so forth. So I'm actually really happy to have them back. I think we're fortunate that their school, they actually did buy themselves a little extra time to really gauge this. So they delayed the start of their school year. They got everyone very well prepared. They did offer an e-learning option, which has accommodated some of our families that have family members with concerning higher risk health conditions. So we're really blessed that we have options and we have good safety in place, and they are back to doing what they need to do, which is learn and be around other children who are also learning and have that great direction from their teachers. They seem to listen to other adults better than to their own parents, and I get it, that's fine. But yeah, we're really glad to have them back now.
Oh, that's great. Yeah, excellent. So for your practice, you do see children as well as adults, right? The whole family can come to see you, correct?
Correct. Yeah, we treat patients of all ages here, and that was kind of in the full scope of my family medicine training. So newborn care, pediatric care, and then all the way up through adults and geriatrics.
Oh, wonderful. Great. So the babies and grandma can come see you, which is awesome.
I mean, that's really one of my very favorite things to do, is to have a large family. And it actually, I think for the big families, you really get a knowing of what's going on. You get the different perspectives of what's happening within a family. And sometimes a family member will shed some light on something that you weren't maybe aware of, or giving enough, paying enough attention to. So that's one of my favorite parts of family medicine, is taking care of the family unit. And so we have tried to make membership at the practice like very accessible for families. So we have kind of family pricing, and our goal is, of course, to take care of the whole family, all ages.
Awesome. Yeah. So on that note, let's talk a little bit about how people can find you, right? So what you got going on, your website, social media, any way that they can find out how to come and see you?
Sure. Yeah. So the best way is through our website. It's www.hobbinsmedical.com. It really explains kind of the details of the practice there. And then scattered all over the web page are buttons that say enroll now. And if you click on that, it'll kind of link you over to a form. It's a common health history. So, how old are you? What's your name? How old are you? Your address? Do you have any health problems? Do you take any medicine? So it honestly kind of builds your chart out. And then when that is submitted, we get a notification that a patient has enrolled in the practice. And then we contact them to set up an appointment, explain kind of how the billing works, if it wasn't clear from the web page. And just that's kind of how the whole process begins. We're also partnering with small businesses. And so for those that are going to be enrolling multiple people, we'll actually create a custom link, and then their workers will sign up through that. And so the employer has their kind of information and payment information in a section that's separate and private from the employees' personal information. So we do partner with small businesses, especially like you mentioned, knowing that there are lots of people that are working really hard, but health insurance is financially out of reach. So we offer a great opportunity. I always tell people we're a good option for people who have insurance that want better access, more frequent appointments, longer appointments, less waiting for appointments. We're a good option for that, but we are a great option for people that have no insurance coverage at all, and at least need to get their primary care needs met. I do always advocate that my patients have something in place for catastrophic coverage, and I can kind of educate my patients on that and point them towards resources for that. So for small businesses, families, individuals that are interested, our webpage is the most comprehensive source of information and really the best way to enroll. If you're not super tech savvy and you'd like to enroll and have one of us assist you in the office, you can call our office phone. It's 219-627-2465. And one of my assistants will basically do your enrollment for you. They'll talk you through it, walk you through it, or do it for you. And then I do have a Facebook page. And so you would just search Hobbins Medical on Facebook. And we try to put interesting updates and share different things on there. And but you can find out some information about the practice there as well.
Wonderful. Thank you. And I will link that too here on Facebook and YouTube as well for people to just have a direct link for that. And I want to mention too, you're going to have an open house.
Correct.
Right? So people can meet you and maybe see the practice before they choose to enroll.
Sure. Yep. Yeah. So we actually have a date kind of pinned down for that. It is Sunday, October 4th. We are going to do a kind of a socially distant open house. We're fortunate that we have a large outdoor space kind of right behind our building. So we're in St. John. We're in a professional center, kind of a strip mall, if you will. It's right across the street from Alsip Nursery, which most people know. And then importantly, we're on the back side of the building, which so we've had some people like they're driving in the front, they can't find us. We're in the back. But what I love about being in the back is it's a wooded area, which is perfect for us with our theme we have going. But there's actually there's a lot of space there. So we hope to have a tent. We're gonna have food that's served carefully with COVID precautions in place. We're gonna have some local live entertainment, some music, and then we will do masked tours of the building. And we hope to have it become kind of like a large enrollment, kind of a mass sign up event. We are looking at different incentives to get people to enroll. One of the thoughts that we have was to offer patients a osteopathic manipulative therapy and OMT session if they enroll while they are there that day.
Oh yeah.
So yeah, we definitely look at it as an opportunity to showcase the office, talk more about what we do, and then incentivize enrollments through kind of offering some free services that we have here in the clinic.
Perfect. All right. So October 4th, Sunday, October 4th. Do you have a time yet?
Yes, thank you. It'll be from 2 to 5 p.m.
Awesome. Oh, it'll be beautiful. Oh, and honestly, like when you go to his practice and you're there in the parking lot and even just sitting in the waiting room and looking out the windows, it is really, truly very beautiful over there. And like you said, goes well with your theme of all the trees, and just it's a very calming experience. And so that'll be really, really nice. So I encourage all of you listening, watching, clear your schedule, October 4th, be there at the open house. So, well, thank you so much, Dr. Hobbins. Is there anything else you wanted to include before we wrap this up?
No, I don't think so, Krystal. Thank you so much for having me and for the opportunity to talk about this a little bit. I would encourage anyone who's interested in maybe becoming a patient to look at the website. All the information is there. We're happy to take your phone call. It's 219-627-2465. It's a great option for the whole family. It's a great option for small businesses that want to support the health of their workers, but aren't able to get there through funding a traditional insurance plan. And yeah, we're here waiting for you to do a good job taking care of you and get you the care that you need. So that's really kind of what we're trying to achieve here, and hopefully most people can appreciate that.
Wonderful. Well, thank you again. I appreciate you taking time out of your schedule to come here and speak with me on the Playful Life, and I look forward to seeing you at the open house.
Okay, Krystal, thank you so much. I really appreciate it.
All right, you too. Have a great day.
Okay, see you soon.
And as always, check out Ron Harlow Media. He has got his podcast every day there from 4 to 6, the Make My Day podcast. The Cheeky Mom every Wednesday at 10 a.m. there as well. You can catch the Playful Life every Thursday morning. And also check out Ron Harlow's Media Facebook to see a list of all of our amazing sponsors and people who keep us going here. So like, share, subscribe, don't be a stranger, and stay playful.